I was diagnosed with PID.
I was diagnosed with PID.
I was diagnosed with PID.
When the doctor first said to me,
"You have pelvic inflammatory disease."
I was really upset.
Especially when she told me that most cases of PID were caused by sexually transmitted infections.
At that time, me and my partner had been together for
Over a year.
For a month, so I was really concerned about going to him and talking about it.
Because I was afraid that he would say,
"You burned me."
Or tell his boys that I was a
dirty girl, man.
But my doctor broke it down for me.
First of all, she let me know that I was not alone, not to feel bad about myself, and that she had my back. She said,
PID is a common medical problem. It's my job to take care of you as my patient and to make sure that you have all the information that you need to take care of yourself. About 1 million women in the United States have PID every year. Some of those patients feel bad about themselves when they get it, but you cannot let that stop you from taking care of yourself.
She then showed me a diagram.
Your physical exam shows the infection involves your fallopian tubes and the upper part of your uterus. I sent cultures from your cervix, the bottom part of your uterus. Since I'm unable to reach the infected area with the pelvic exam, your test may not come back positive, even if you have a sexually transmitted infection. Even if the test from your cervix exam come back negative, you still must take all of the medication.
This sounds serious. I don't know if I can do this by myself.
Well, you can talk to one of your parents or any other supportive adult. I'll support you too, but you have to come back to see me within 48 to 72 hours. And at that visit, I'll examine your belly again and make sure you're feeling better.
She also gave me the opportunity to ask a lot of questions. I don't like taking medication, so I asked her what to do if I had trouble keeping the medication down.
If you're having any problems taking the medication or if you're vomiting, then you need to call the clinic right away, ask to speak to me or any other doctor, and we'll figure out what you need to do next.
I was also worried about how long I would have the pain. She said,
most patients feel better after a few days of the medication, but again, it's important that you finish all of the medication. Some patients develop complications. If you have a high fever or if your belly pain starts to get worse even while you're taking the medication, then you need to call us right away and set up a follow-up visit.
Suppose I miss a dose of the medication.
Please try not to miss any doses, but if you do miss one, take it as soon as you remember it. And it is important that you drink an entire glass of water.
Is there anything else I need to do?
You need to talk with your sexual partner so that he can go and get treated. He can go to either his own doctor or to a local health department, and even if the test results are negative, you both have to get treated.
What if my partner refuses treatment?
Then you shouldn't have sex with him until he does get treated. If you're afraid to talk to him because you think he might hurt you, or if you continue to have sex with him because you don't want the relationship to end, you're putting yourself at risk for further problems.
What kinds of problems?
Well, women who have PID are almost 10 times more likely to have a tubal pregnancy. Now, this is an emergency condition and it requires surgery. Young women who have PID are at greater risk of developing problems with infertility or getting pregnant when they want to.
So, you're saying I'm not going to be able to have a baby?
No, I am not saying that you won't be able to get pregnant when you want to. I am saying that it's important that you take care of yourself this time and that you protect yourself in the future by using condoms. Because each episode of PID that goes untreated or just partially treated puts you at risk at developing more problems.
So, after the doctor gave me the facts, I left the office feeling depressed and even a little ashamed. Even though I don't think she was making me feel that way, I know it was her job to be honest with me.
The first day, I almost didn't take the next dose of medication. But then I just got a huge glass of water and started taking it.
I was worried about my family and friends finding out. How was I going to tell my partner?
And even worrying about having a baby, even though I didn't want one anytime soon.
But I knew if people found out I had something this serious and didn't try and take care of it, that would be an even bigger issue.
Besides, I knew I needed to do this for me and my own health. All of this is to say that
PID is a common condition.
But it is important for young women like us to take care of ourselves now to protect our reproductive future. When I think about it, taking care of myself wasn't that hard.
There are only a few things you have to remember.
You have to take the medicine for an entire 14 days with a huge glass of water.
Come back to the follow-up appointment within 72 hours
so that they can change your plan if you're not getting better.
Most women don't get hospitalized, but some women need to get antibiotics in the hospital.
Don't have sex while you're being treated, so your body has a chance to heal. And
Lastly, you have to tell your partner so that he can be treated while you're being treated.
If you have sex with him before he's treated, then that infection that's causing your pain and symptoms can come back again.
If you are important to him, then he'll do it, right?
Right.
Please ask to speak with a nurse or doctor if you have any questions about anything you've seen or heard in this video. If you don't have a primary care doctor or clinic to go to for your follow-up, let the doctor or nurse who cared for you today know so that they can help you get a follow-up appointment. Thank you for listening.